Hey everybody, this is the first video in our little abnormal psychology series. And we're going to begin by talking about what is and what is not normal. What does the word normal mean? If we're going to have a course on abnormal psychology and we're going to use that word, then I would argue that we need to know what normal means. If we're going to talk about what abnormal is, a deviation from normal, we should know what normal is, right? And we're going to begin by looking at a couple of vignettes. Uh, on this little video, I think we're going to look at two vignettes. So here's the first one. You're a psychologist in private practice. A woman in her 30s comes to see you for therapy. Her presenting complaint is that she has severe panic attacks whenever it rains. Her heart begins to pound. She breaks out in a sweat. She cries. She feels nauseous and dizzy. It's not written here, but she also grabs her baby and wants to run, but she doesn't know where to run to. Her 18-month-old baby daughter is with her, and the baby seems well. The baby's plump and healthy and getting into all the stuff in your office, which indicates that she's fine for a toddler. Her situation is complicated by the fact that she lives in the Pacific Northwest, where it rains frequently. So my question to you is this normal? Is this woman's behavior when it rains, her panicking, her crying, her sweating, nausea, dizziness, are these normal? And just keep that in mind. Just keep your response in mind. And let's continue. You ask your patients when these symptoms began, and she tells you that they began about a year ago. You ask if anything unusual happened a year ago, and she tears up and sinks in her chair. She tells you that her home was flooded. She was alone at home with her twin 6-month-old daughters. They were swept away in the rushing waters. She managed to grab one, but the other disappeared under some furniture underwater, and she was unable to save her. She and the other babies survived. So I'm going to guess that between the first part of this vignette and the second part of this vignette, you changed. I'm going to guess, typically when I do this with students, when I tell the first part of this vignette, just the history of it, the response is, yeah, that's not entirely normal. You shouldn't be crying and fearful and grabbing your baby and nauseous and dizzy when it rains, especially if you live in the Pacific Northwest. That's not very adaptive. But when I read you the second part of the vignette, I'm going to guess that you changed, that you felt some compassion and some empathy for her. And I'm going to guess that it didn't seem quite as abnormal to you. Maybe now it was understandable. Maybe now you're thinking, maybe what she's having is a normal reaction to an abnormal situation, right? So think about that. And think about the change that happened in you. We change when we understand people. And the relationship between us and them changes. And unfortunately, even the diagnosis can change. If we're talking about normal or not normal as being a diagnosis here, it can change based on whether you understand the person's story and their history. What she has given you here in the the third paragraph, the big paragraph that begins over here, what she's given you is the etiology of her illness. Etiology, Etiology. And what it means is history of the illness. She's telling you the history. Okay, let's look at the second vignette here. The second vignette, the woman who comes in to see you is the same as the previous woman. This is the same person, the same history. She had twin babies. She lost one. And there are some differences, but otherwise the same history. So she comes to see you, but her symptoms are different. She has open sores on her face and arms, and is encompassed by a pungent cloud of perfume combined with poor hygiene. So basically what this is telling you is that her hygiene is poor, but she's also aware of it, which is why she's trying to cover it with perfume. Her hair is thick with grease and flakes. The baby is clearly failing to thrive and looks more like an 8-month-old than an 18-month-old. The patient tells you that she is not only fearful of rain, but is entirely phobic of water. She cannot even drink or shower. The only fluids that she gets are from fruits and vegetables. She tells you that she is still nursing her baby. You know that a woman who is not getting enough fluids herself certainly cannot have any milk for her baby, and you are concerned that the baby is malnourished. Occasionally, your patient mutters to herself and seems to be responding to somebody who is not there. So, if I were to ask you what the difference is between this patient and the previous patient, you can't answer because I'm speaking to the computer. So I'll tell you my answer. I'll tell you what I'm seeing here, and that's that we have the same problem, the same potential disorder, which would be, some kind of PTSD, right? The difference here is in severity. It's really the only difference. The second woman who comes in to see you, the second patient, her case is more severe. Her symptoms are more severe. The etiology is identical, and she has the same kind of disorder. It's a trauma response that includes anxiety and phobia. It's the same response. It's just worse. Sometimes when we talk about abnormal psychology or psychological disorders, we look more carefully at severity than at the diagnosis itself. So not so much the what, but the how bad. So, for example, you might have a day where you are depressed. You can get out of bed, or even a week. You can get out of bed, you can go to work, you can go to school, you're eating okay, maybe not. But you're functioning, maybe you're crying more, sleeping more. Now let's look at somebody who is depressed, but can't get out of bed or go to work or eat or sleep, and is suicidal. So that's the same problem, the same diagnosis. We're talking about depression. The difference is in the severity. So the difference is in the how bad, not the what. So we're going to stop here, and we'll continue with some more vignettes in the next video.